Just a few thoughts this morning about psychodynamic therapy. So, upon its founding, psychodynamic therapy was based on the principle that if we make more of the unconscious conscious, symptoms will be relieved, and that most symptoms are related to something that's happening unconsciously. And some of the founding principles were, if we make the unsayable sayable, there will be relief. If we make the implicit explicit, there will be relief. If we say things out loud that we have not had a chance to say before, there will be relief. And mostly that insight on some level is king, and that when we develop insight, we will stop engaging in the things that both harm ourselves and others. And the two main techniques by which this would occur was free association and dream analysis that then the therapist would respond to through interpretation. And there's a lot that's really wrong with all of those ideas, which basically lodge pathology in the intrapsychic space of the client alone and empower the therapist to be the expert on how, through interpretation, relief can be found. Fortunately, psychodynamic therapy has really evolved over the years, and with the onset of relational theory, which was sort of born at the same time as Freud, kind of got put away and is really way back in. The belief now is that you can actually get well through the treatment relationship, that the relationship itself is what heals, and that given that there's so much material brought up in the therapeutic relationship, that there's enough there to work through to get to all of those things. And perhaps most importantly, what makes the therapeutic relationship unique and helps the client and the therapist access all of those things I had just talked about is the belief that the therapy is mutually subjective, that nobody in the relationship knows one truth, that there is no objective expertise within the relationship, and that given the mutuality of the subjectivity, there's actually healing because each person sees the other as fully human.